Heard many statements about revenue. Not a lot about cost containment. And colleagues, school districts are going to face a $335 million increase in PERS. So let's talk about that for a minute. According to an analysis conducted by Millman, the state's actuary for the public employees retirement system, school districts are expected to spend an additional $335 million on PERS benefits during the 2017-19 biennium. Employer contributions are expected to continue to increase dramatically over the next decade. According to a recent report by the Statesman Journal, quote, the 900 Oregon public employers in the system, state agencies, school districts, cities, counties, community colleges, universities will collectively face $6 billion in additional costs over the next 6 years. PERS costs will increase from an average of 15% of payroll to 30% of payroll. The Statesman Journal cites comments by Econ Northwest. With each percentage point of increase in payroll, the equivalent of 325 teachers statewide lose their jobs, or 1.3 school days are canceled. Fewer school days for our children. And we heard earlier, PERS is an obligation that we need to deal with. That's correct. The majority party has not allowed one single PERS reform bill to receive a vote on this floor this session. Not one. And I would agree. We do have an obligation to deal with PERS. That is a correct statement. Yet again, the majority party has not allowed one single vote on this floor. I've heard let's put partisanship aside. Okay. Colleagues, Oregon has the highest government employee health costs on the West Coast. Recent analysis by the Registered Guard noted that premiums for Oregon K-12 employees are the highest on the West Coast. The Registered Guard reported an average premium cost for Oregon K-12 employers of $12,204 per employee. California and Washington plans are considerably less expensive, with an average annual premium of $9,825 and $9,360 respectively. A recent study given by Portland State University reinforced much of what was reported by the Registered Guard, and according to the study, which was overseen by Democrat former Secretary of State Phil Kiesling, and I quote, research also shows Oregon districts' employer-paid health care costs to be similar to Oregon state government employee-paid costs, which a 2014 Pew study found to be some of the nation's highest. PSU found dramatic differences in the cost of providing health insurance when comparing Oregon school districts to districts in other states. Just a few examples. Lake Oswego, $18,713 to provide that health insurance for an employee. Seattle, a mere $10,016. Portland, $16,385. Vancouver, Washington, right across the way, $9,360. Hillsboro, $13,539. Boise, Idaho, $7,320. And if I recall, if my memory serves me correct, Oregon ranks below these states in education. Republicans again have introduced a number of bills focused on reducing the costs of providing health care, benefits to public employees, but few have received any consideration by the majority party.
Representative Barreto yields.
Again, we have introduced ways to cut the costs of what I just went over, but the majority party has refused to give those any consideration, little if any, and none of those have made it to this House floor. So again, I've heard earlier, colleagues, from folks that those are fixed costs, and that's a cost of doing business. Yet there are ways to do that better, and we have yet to see that because the majority party has refused to bring those to a vote on this floor?